The phone rings and receptionist picks up. Hello, this is doctor's office. Please hold.
All of our representatives are currently busy. Please stay on the line, and your call will be answered by the next available representative. The estimated hold time is currently less than 96 minutes. You are currently caller number 32, waiting to speak with a representative. Thank you for your patience.
The patient waits and waits. Frustrated, they hang up and call back. Doctor's office, please hold. Again, sounds familiar? Hold on a minute, I'm checking, she replies, placing the call on hold. After a moment, she returns to wrap up the conversation before hanging up. A few minutes later, another call comes in. Another patient waiting for prior authorization. The nurse sighs and answers it. Hold on a minute, I'm checking, she says again, juggling endless tasks. She ends the call, only for the phone to ring again. Now a request for an appointment. She glances at the system, but the schedules are buried under layers of other work. Patient notes, paperwork, and insurance requests all vie for her attention. As another call comes in, she hesitates, then lets it ring. Another one follows. She sighs again, not picking up. Work keeps piling up. The healthcare provider is losing money, faster than they can count. Endless insurance calls, denied claims, pending authorizations. Every delay means lost revenue. Every mistake adds to the chaos. The staff scrambles, tossing out documents while keeping stacks piled high on their desks. They rush back and forth, trying to figure out what to do first. But the work keeps piling up. And so do the losses. Phones ringing non-stop. Patients waiting. Billing errors leading to rejected claims. Then the doctor walks in, frustrated. What the hell are you all doing? The staff looks up, exhausted. Doctor, we have so much work, we just can't keep up. Another claim denied, another hour wasted on hold. Another paycheck slipping away. The doctor sighs, shakes their head, and walks away. Just as frustrated, not knowing what to do next, he sits down at his desk, exhausted. He looks at the stack of papers and notes in front of him, unsure of what to do. Back at the desk, the nurse sits frozen for a moment. The calls are still coming. The paperwork hasn't moved. The system still displays an overwhelming number of pending tasks. How can I do all these things? Is there any solution for this? She thinks for herself while doing the heavy work.
All right. Welcome to the webinar on outsourcing and how you just saw that. And I think this is a daily story, not just with smaller practices, but this is a daily situation. What we see today when I walk into doctors' offices, I've been going around to multiple doctors' offices, and this is what we see. Too many phone calls, doctor's office, please hold. And, I tried to call my doctor, and then, I actually left them a message yesterday. I haven't heard until today. So it's a staff burnout, staff shortages, and it's a crisis. Reimbursements have gone down. So let's try to talk about how to fix this. But before we get there and run some introductions here, I have a disclaimer that I would like you to understand before we proceed with the session. So by attending this webinar or watching this video later on, you agree and understand that our guest doctors and advisor are not affiliated with Staffingly, and these views and opinions are on their own and for educational purposes. So let's dive right into the topic for today. I'll quickly run some intros here. By the way, my name is Dan Nandan. I'm the CEO at Staffingly Inc. We are a healthcare outsourcing company. Joined by me, Dr. Shalini Vaid, a family medicine practice from Maryland. She joined us as a guest speaker, and along with Dr. Amer Nawaz, a PharmD. He is been with Staffingly for over 4 years now. So we'll get started right there before we get into the details and how outsourcing can help with staff shortages, staff burnouts, and also save 70% in staffing costs. We'll just quickly run through our guest, Dr. Wade. If you can just give a quick intro about yourself.
Sure, Dan. Thank you so much for having me. My name is Dr. Shalini Vaid. I'm a family physician in Hyattsville, Maryland, and currently running a private practice with my dad, who's also a physician. So I think this is a great topic to discuss because there's a lot of benefits um, to having this kind of service in addition to what we have in office.
Thank you. Dr. Nawaz, can you just give a little brief background about yourself?
Sure. Thank you. So, hello everyone. I'm Amer, and I have a doctorate in pharmacy. I've been working in healthcare outsourcing space with staffing for almost 4 years now. Specializing in prior authorizations. My experience spans across specialties like radiology, cardiology, orthopedics, dental imaging and procedures, pediatric endocrinology, and specialty medications. So, I'll be helping to ensure clinical justifications for these products. They align with the insurance guidelines for fast track approvals. My goal is to take the administrative load off physicians so that patients get the care they need without unnecessary delays. I'm excited to be here and looking forward to the discussion. Thank you.
Okay, thank you, Dr. Wade and Dr. Nawaz for that introduction. So before we jump in, once again, I will be the moderator for this session. I'm also a speaker. My background, once again, my name is Dan Nandan. I'm the CEO at Staffing League Inc. We are a 7-year-old healthcare outsourcing company. I've been in staffing, outsourcing in healthcare, IT for over 20 years. And I've seen the shift after COVID, and we've been helping a lot of healthcare providers with their staffing needs, mostly with outsourcing. And I do understand the compliances. I understand the staffing world, how contracts work, and how it differs from state to state. So before we jump into, I would like to touch the basics a little bit. For a lot of people, I do have clients who often ask me, this is the first time we've heard about this. What is outsourcing? Um, Outsourcing is, it's also referred to as a business process outsourcing (BPO). And what is outsourcing in healthcare? It's just that you think about, you have hired an employee today. There are a lot of people who want to work remotely. They don't want to come to the office. So anything that does not require a physical presence, usually these jobs are given to employees who can work remotely. Outsourcing is giving it to a third party, like our company, Staffing League Inc., and getting your work done, in simple words, which can start anywhere from scheduling, taking phone calls, and making sure the patients are not going on hold. Somebody efficiently taking all those calls and handling your insurance verifications, handling your prior auths, your revenue cycle management, your scribing, including updating those charts, efficiently working with the EMRs. So this is what is outsourcing about, which also results in 24/7 support and an educated workforce, trained workforce, who can support your practice at a fraction of the cost. This is in simple terms. But then, if you'd like to learn more about this, you can always, before we jump into the session, our website is staffing leave with an ly, staffingly.com. You could log on to our website, book a call with us. I will be on the demos in most cases, not like a salesperson. I'm the business owner. So I will be right in. But before we get there, before we engage into a discussion with our expert guest today, we would like to know, and I would like everyone to know, healthcare providers in the US right now, they lose on an average, there might be a small practice, large practice, they lose about $200,000 a year in lost revenues. And a lot of them don't even know that they've been losing this money, number one. And number two, some top hospitals, as top chains, they have adapted to healthcare, saving about $10 million a year. And the other statistics also show that about $31,000 is lost per physician on an average. So look at your own numbers. And, because there's a delay in prior authorization or a denial, or, loss of patients because of delays, they're just moving to another provider. So this is what is happening right now. And post COVID, things have changed. We're not here to, outsourcing is not replacing any American worker. Outsourcing is purely extension of the workforce. Your local in-house staff members can do better tasks, handling patients, handling the providers, assisting the providers, and do better tasks rather than just getting submerged in paperwork, administrative tasks, phones ringing every other minute, and then keeping three people on hold. Then there are patients walking in, and they have a copay, they're confused, they walk in, they need a medical record, their prescription refill is missing, they're coming and shouting literally. I have seen this. Last 1 month, I've been walking into a lot of clinics, small, medium, large. I see this happening everywhere. So that's what we're trying to fix today. And if you if you think this session is going to make some sense, we'll take a quick pause. Please like if you're watching on LinkedIn or YouTube. If you can like and share, it can benefit others as well. Now, if you have a question, we will take comments after 15-20 minutes. And we will also be covering a lot about AI in healthcare. And there's a new announcement by Microsoft, which I will definitely cover at the end, before the end of the session. So stay tuned. And if you can like and share, it will definitely help. I do see on LinkedIn there are many practice administrators who clicked attending this session. It looks like they're getting the for every practice administrator out there watching the show today. I know you are getting sandwiched between the patients, local staff members, your doctors and providers. So we'll try to fix this. We'll try to help you on how to navigate these challenges. Now, let's quickly jump into the discussion with our guests. This is for Dr. Wade. Dr. Wade, once again, good afternoon, and thanks for joining the session on our invite. Um, what do you think? How much time doctors spend on administrative tasks instead of patient care? But the studies show, right? Physicians nearly, if they're on their own, small practices, even mid-sized practices, spend half their day in trying to enter the chart, trying to run through, where the money is going and what's happening with my bills. So can you speak a little bit on your experience as a physician for a number of years, and with your own practice? Can we enlighten our viewers today? Thank you.
Sure, sure. So we all know as healthcare providers that the medical space has definitely changed a lot in terms of using an electronic medical record. But for a physician, a lot of times we spend so much time trying to chart, trying to, return labs. We manage a lot of different things. So I think, yeah, we are inundated with a lot of different tasks, and we spend a lot of time away from patient care, taking care of those things like prior auths, writing notes, even like managing, the questions from our staff. And so I think, a lot of different modalities have kind of come into market, especially with AI and electronic medical records. Also, virtual assistants, things like that, can also help us to reduce the workload that we have. We usually are taking work home, doing charting at home, which takes away from our families and also our personal life. So I think it's important to kind of look at work-life balance, and that's really important in every physician's life, as well as patient care. How can we better serve our patients and provide better care?
Okay. Thank you. Thanks for that explanation. Now I'll quickly like to jump into on your words. If you can read on my hat, make patient care great again. So let's try to make patient care great again. Now, jumping into Dr. Amer Nawaz, a follow-up question to you, to Amer Nawaz. Dr. Nawaz, here you go. And what do you think is the solution if these challenges are pretty common among healthcare providers, as Dr. Wade tried to explain? What do you think? You see, with AI, human expertise, and outsourcing coming together, I think the AI has changed a little bit. It's got a lot better since 2003. In about 2 years, we see a lot of changes. So what is the conjunction between the human services plus the AI? Since this topic is about outsourcing, can you touch that a little bit, please?
Yeah. So physicians, they are overwhelmed with administrative tasks like insurance verifications, prior authorizations, billing, leaving less time for patient care. So what's the solution? A combination of AI, human expertise, and outsourcing. So let's talk about AI automations. AI can pre-fill your prior authorization requests. It can verify insurances instantly, and it can also flag missing documentations. All this reduces the delays. Talking about human expertise, we have trained clinical teams. They handle complex cases, appeals, insurance guidelines. To ensure that approvals happen faster. Uh, and then we talk about outsourcing. So we have virtual medical assistants. They take on administrative tasks. They reduce the physician burnout, and this allows physicians more time for direct patient care. For example, in a radiology and cardiology practice, prior authorizations for CT scans, MRIs, echo, stress tests, it can take days. But with AI, outsourcing, and human expertise, approvals happen within hours instead. So the same applies to other specialties as well.
Okay. Thanks, Dr. Nawaz. Dr. Wade, do you have anything to add on those lines of what Dr. Nawaz has been talking about? You have anything
Yeah,
to add there?
I think I kind of agree with what he's saying. Like a lot of times with prior auths, it's great to have that information pre-filled. We just want to make sure that it's correct. And I think a lot of times patients don't understand how long it actually takes to do a prior auth. If you've done it on your own, you know that it could take up to an hour sometimes, like trying to fight for these things. And as a physician, we'd like to know, what does a prior auth require? What kind of medications have we needed to try before things are accepted? And that's a little bit hard when you're seeing patients. You don't know their insurance. You don't know, what other things they're requiring to cover a medication. So I think those things can be helpful for physicians because we can make better choices in terms of, do we switch to another medication, or do we actually do a prior auth for another medication? And so those things can be helpful, like pre-filling, like you're talking about, and somebody else outsourcing those tasks so we don't have to spend time doing those instead of, talking to our patients and educating them.
Right. So now, what happens if for example, a critical condition patient? Now that has been a big challenge with major insurance companies. The extreme delays in getting those prior auths, approved, and obviously, if it's like a surgery, it's going to cost a lot of money. Now, do you think patients start shopping for other doctors, or they just end up in emergency room? Have you seen any of these type of, like a case study? Have you seen any of these type of complex situations in the market?
In terms of patients going somewhere else because they can't get the care they need?
That's right.
Sorry, clarification. Yes. So sometimes that does happen, but in terms of, if we're talking about prior auths, in terms of, getting a medication for a patient, I think those problems are going to be anywhere. So it's also important for staff to educate patients about how a prior auth works. I get a lot of questions from patients or statements like they go to the pharmacy to get a medication, and then the pharmacist apparently will tell them, oh, just have your doctor say that it's okay. They can just get the medication. So I think a lot of times patients are thinking we just have to say, oh yeah, they need that medication, but it's a whole process. So I think in terms of being a physician, it's important to expect, place better expectations on wait times as well. So even if somebody else you're outsourcing your prior auths, the good thing about that is the person who's handling that can actually talk to the patient and say, yes, it's going to take a couple of days. Here's where we're at, or you need to try different medications. So I think there's a lack in maybe communication a lot of times with the pharmacy, the patient, and the practice. And so I think somebody covering that and explaining it can kind of help get the medications we need in a timely manner, or have alternatives that are covered by the patient's insurance. Because most of the time, patients can't afford a lot of the medications, the branded medications.
Okay. Thank you. Uh, you've heard that if one of you are a practice administrator or a provider yourself watching the show, we have an amazing audience today. Our first time doing this webinar on staffing leave, but we are really excited to see all of you logging in. It's a work day, mid of the week, but thanks a lot. But if you have any questions on those lines, let it be about compliance or the process itself or outsourcing, we are going to be touching a lot of topics within the given time frame today. I will try to speed this up. We're already 20 minutes past the show. Now, let's jump into what's happening with this outsourcing, and what are the countries that are being outsourced the services to. In most cases, uh, the top two countries right now for processes are uh, IT. It's definitely tops with in terms of the economy, India, and then followed by countries like Philippines, Central America. There are a lot of places the outsourcing occurs. Now, since our business is located in India, I will only focus on what's happening with outsourcing in India. India has a lot of advantages in terms of India produces almost 500,000 healthcare graduates a year. Graduates, maybe doctors, um, pharmacists, doctorates in pharmacy. Many of our employees they hold doctorates in pharmacy and MBAs in healthcare. Many of them are right now working with the outsourcing BPO companies, which I touched earlier, supporting mostly countries like to start with North America, going into Europe. And by the way, there are bilinguals in India who speak Spanish, Russian, German. There are Spanish universities. So, if someone is looking to outsource, thinking, hey, we need bilinguals. We just don't want people who speak English. We also need somebody to speak Spanish. We have many employees who are bilinguals. They're not native speakers, but level 2 speakers. That's absolutely okay. They are interacting with customers who are your patients. So that's a possibility. And with the highest level of education, higher degrees, MBAs in healthcare, doctorates in pharmacy, they know the medical language. And the latest breeds who are graduating, they also have a lot of computer science topics when they go to college. So it's easy peasy to work through the systems and softwares like EMRs. Trainings don't take days and years, and they're not able to go through the screen. So that's what it is. Now, let me talk about something. I've had many of our clients, doctors, asking me, "Oh, you're outsourcing to India." Now, Indians have a thick accent. I was not born here. I can communicate pretty well. And you just heard Dr. Amer Nawaz, one of our senior employees. And, they all communicate pretty well. I think that's probably, in olden days, 20 years ago. Do they have an accent? Yes, of course. There is no native speaker. As long as they are able to communicate with the patient, be compassionate to the patients, be compassionate to your staff members, and they're able to talk to the insurance companies. This is the myth. And I would definitely say most of the education, the entire education system, 99% today in India, it's in English. India is the second largest English speaking country in the world. So let's jump into okay, now when we said talking about as again, I'm not talking about uh, shipping jobs overseas. We are only talking about getting an extension. So there is less staff burnout. You're able to give more patient care and make it great again. And but what's the difference when I say, cutting costs, 70%, what we claimed on this webinar, the average salary with your employer expenses, one doctor, I was talking to a healthcare provider. He said, I only pay $25 an hour. But then what about your Social Security, Medicare employer portion, FICA, and the unemployment, potential unemployment claims, and the health insurance, if you have 401k, if you have PTO. So you should factor, if you are paying somebody $25 an hour, you should factor at least another 20%, at least. It can be higher, based on 401ks, many of or maybe it's just ignored. So if it's 25 2080 hours in a year, is roughly $50,000 a year, and your base cost to have them is about $60,000 a year, going up to 80,000. So when I said that, now 70% cost savings on about 60 70,000, it is down to $20,000 per resource. So this is what we're looking at, getting the same quality of service, uninterrupted service. That's where you have a cost savings. So I'll jump right back into Dr. Wade. Dr. Wade, now, what major pain points have you experienced with insurance verifications and prior auths? I know you touched this a little bit, but I really want to talk about this. This is what we see today. Many calls that we get, looking for services, they're only focusing on one, scheduling, phone calls, then blending into insurance verifications, and then definitely prior auths. And what do you think, how these challenges will once again uh, have an impact on the services you provide?
Sure. So I can kind of touch on, how my experience has been in the practice. So I think, as I touched on before, prior auths take a lot of time, and we weren't able to handle those with the staff that we had. And so that was one of the main reasons we felt like we would try, kind of just like an outsourcing, because we were trying to handle those on our own, and it was just taking a lot of time. So doing that, we also, like, for us, we have our billing company doing our verification. So I can't really touch on that, but it is very, very helpful because every practice needs to verify someone's insurance if they're taking that, so that we know what people's co-pays are, and also if we accept that insurance. So I think, in certain ways, this has helped out quite a bit. And in terms of it also trickles down into patient care. Because before we weren't able to do the prior authorizations, we'd have the patients go to the pharmacy and then figure out what medications were covered by the insurance. And so now we have somebody who's handling that for us. So when I ask them, okay, what are the requirements for the medication to go through, they'll usually tell me, well, they have to try this medication before they even accept it. So knowing that is really good information for a physician, especially because before I didn't know that. I was just kind of trying different medications and figuring out why isn't this medication covered? Is there some other medication that I'm supposed to try before? But sometimes I disagree with the insurance. But at the end of the day, they're the ones that are covering it or saying you need to try this, this, and this. And so I think it's really helpful to have somebody doing that. Also, touching on another reason we decided to kind of outsource is we do have a staff and they do answer phones, but they do get busy. So scheduling, when patients call in or have questions, we needed somebody to kind of answer the phones for that. So that's been helpful as well, and that's another reason we tried to outsource and see how it was going, and I think it has been helpful. We still do answer, obviously, phones in our office, but if we are busy with a patient, that goes to our remote person. So there's definitely different ways in which it's very helpful, but I think every practice is going to be different in terms of how they operate and how they have their person helping them out, especially because they have a different EMR, also different staffing needs and things like that. So that's something that each clinic and each person has to kind of determine how it will be helpful for their particular clinic or hospital to have somebody else. What are the roles? You have to kind of define that and see where you need help. And I think that can really help everybody in the practice to work together if you have defined roles.
Okay. Excuse me. Thank you, Dr. Wade. Before I jump into the next topic, I do see some comments coming in, and then we'll just say hi to the commenters. Um, Interesting, Hemant Random on YouTube. Thanks, Hemant. And then we have Kumar. How can we be sure outsourcing is HIPAA compliant? Kumar, I'm going to touch that. That's our next topic, HIPAA compliance, PHI, and I will definitely touch that. Then we have hello from Florida, Christy D. Williams, customer services professional. Are you in healthcare? Looks like you need an extension staff members. Hi, Christy. Uh, Thanks for joining. And then we have um, Justina from Dubai. Wow. You have a staff burnout in United Arab Emirates as well. I didn't know that. Then we have Sumit. We've considered AI scribe. Sumit, but how accurate are they? Okay, I totally get it. I'm going to touch that as well. Usage of AI, accuracy. Dr. Wade touched something. Every practice is unique and different, so we will get there. Thanks for joining. And then, if you have any questions, please post them under comments. We are live on LinkedIn and YouTube as well. YouTube handles Staffingly. Please check us out, and follow us. And we don't definitely post crappy content. We will definitely ensure we are posting some educational content which you can use to improve your revenue cycle management. Now let me go back into the HIPAA. So now HIPAA compliance and security. I think I should touch this. How outsourcing companies can, what they do, what is that you have to look for. Now, what is happening? You have someone trying to connect and work remotely. Most of the outsourcing providers are HIPAA compliant, like us. We are HIPAA compliant, and we run through a 6 month process or a 8 month process through security and compliance, which at that point we get audited and we get the certifications that we are compliant. In general, the powerful certification is SOC2 Type 2, where patient data is secure, the transmission is secure, and then the regular HIPAA certification, and then there are other security protocols like ISO 27001, and then there is high trust. There are multiple certifications. So this is what you need to look for when you try to choose an outsourcing provider. Are they certified? Are they using virtual private network, secured networks to connect to the remote systems, if they are your systems or your EMRs? Are they highly qualified? What is their background? Think about, for example, we have Dr. Amer Nawaz, who's a Pharm D. Think about somebody who's a Pharm D with such a higher education, working with the patient. He understands the nitty-gritties, and he understands the nuances of the healthcare system. He understands the value of PHI, patient data. So they don't, it's not just about security technology. I have a bunch of cameras in my office, biometrics, but humans are humans. So what type of humans are you working with? This is the first question I would ask if I really want to hire a programmer. I'm not going to, talk to a financial guy. Hey, do you know programming? Do you know coding? So these are the, questions you need to really put forward before even thinking about security. This is what is working for, and there are systems. There are we are in an advanced AI world today. There are technologies and protocols, the secure tunnels that they can connect to your computers, unable to download any data. And at our company, we do not use any of our own softwares to download data. This is the most important part. I do see many outsourcing providers have their own softwares where they are trying to download the patient data and work on their system. So that is one no. That's where you can get in trouble. That's where you can have a liability. And the most important thing here, when you're choosing an outsourcing provider, are they locally in the US? Do they have the capability to cover you with a liability insurance, a general liability, umbrella, and a cyber liability? What if tomorrow, God forbid, you get sued by a patient, even though it's not your fault, it's not your outsourcing company's fault? Who's going to cover your practice? You're a small practice, and you don't want to get sued for a $5 million. So this is another factor. And if you'd like to speak to me about this, you can set up a demo, staffingly.com/demo, staffingly ly, and our phone number is 800 toll free 800 489 5877. Once again, it's 800 489 5877. So before I get into speaking with our guests, I would like to touch one more subject about the AI's role in healthcare and how AI is helping today with documentation, automation, verification, scheduling, scribing. AI is playing a major role since 2023, and even earlier there were automations. Um, these are two different things. Automation is different, workflows, AI. I'm not going to get deep into the technology today, but then AI is able to, just like you're using ChatGPT, AI is able to, you can upload a voice note. AI can, you don't really need, if you're a small practice and you don't want to spend, too many dollars, just a voice transcription, open up your ChatGPT app or any note taker app, upload your voice, then you get a clear transcript. Then you can change it into your burp notes or whatever notes and update to the chart on the EMR. This is one way. But then, is it accurate? And what happens to the data I'm trying to have patient's name, patient's date of birth, patient's conditions? It's still a question mark. Anything can get hacked. And how best the AI companies are processing your data, what they want to do with your data is a big question mark. Because when they, everybody wants, data is, information is money, data sets are money. So this is something I would be definitely careful about. I would still think, even today, to protect the healthcare data, it has to be a AI assisted, just like what we do AI assisted services. With prior authorizations, it's faster. Medical scribing, yeah, you look at it, then, a human is validating what this is, listening to the actual doctor's conversation. So you definitely still need a human touch, unless you're doing on your own, spending half a day just, trying to update the charts. I spoke with a doctor. He said, oh, I st- after 4 o'clock, from 4 to 7 or 8, I sit down and, I'm updating everything. You're spending 4 hours, away from your family, still trying to, and get ready in the morning, run again, start looking at patients. But AI can, I would say, if I take an example of scribing, it would definitely reduce from about 90 minutes to complete a scribe based on a 20-minute consultation with a patient encounter. It can definitely reduce it to 45 minutes, including using another human scribe. Um, so Now, let me look at some comments here before I get to Dr. Vaid again. Um, okay. Okay. Amir, can you take this from Chandu? A big concern in our practice is patient communication. Do outsourced VMAs have strong English skills? We don't want the thick accents to frustrate patients.
Sure. So we just spoke about it, and as most of us in India, now we have better communication, and we make sure our staff goes through stringent training, and we are communicating well with patients. You guys actually understand what we're able to convey. Uh, yeah, there's no doubt about thick accents and the communication.
Okay.
So I'd
Okay.
just like to add something to that. So
Sure.
yeah,
Yeah.
you do worry about, it's not an American accent. So you also have
Right.
to understand, everybody, even people who are from the States, sometimes we do have accents. And so I think it's important to communicate with whoever you're working with, because there's also some cultural ways of speaking. So for me, I always try to tell my staff member, okay, this is how, if somebody's getting frustrated, this is what you will do. So there is some training. It's not like anybody is just going to be up and running. You have to kind of explain. Like I work in Hyattsville, Maryland, and so sometimes with American culture we could be a little bit more forceful. So things like that. But I think overall people don't really get that frustrated. I mean, I can't speak for everybody because everybody has a different way of communicating. So I think it's just important to set realistic expectations with whoever you're working with and say, okay, well, if a patient gets angry, which happens all the time, but I can imagine if I culturally did not live there, and I was maybe female and somebody was kind of shouting at me, how do you handle those things? But I think a lot of times it is experience and how do you calm down patients, because yeah, people are sick, they're frustrated, and they take their anger out no matter who the person is. So I think training your staff is important. So just because you have somebody that you're outsourcing, you're still going to have to do a little bit of work to kind of get them to up to speed. They don't know even what your clinic really looks like. I mean, they're virtual. So explaining that or being a resource to them to say, okay, if you have any issues, maybe I could help you through that. And I think, Dan, you can chime in on that. How do you actually, kind of train your staff into cultural nuances and issues? I mean, do they take a course, or how is that done for
Yeah.
your company?
Yeah. That's actually a good point, Dr. Wade. Yeah. What we do, we have a just like a vehicle check. Our VMAs are trained through cultural checks, and then including languages. For example, um, the spelling for authorization in India is with an S. In the US is with a Z. And so some people don't like to be called sir, madam. It's stuff like this. They have to go through the cultural training part as well when they're addressing patients. And even in the US, you are they're definitely working with diverse patients. It's always customized. For example, if I have a doctor in New Jersey versus doctors in Florida, which we work in different locations, multiple states in the country today, with close to about 300 agents. I will touch that a little bit later on. But then, yeah, there is an extreme training of how they fit into the role. And then they many doctors have their regular ongoing patients, like yourself, internal medicine, family medicine. So now they get to know their patients. That's where I touched before. It's what we do. We provide extended staff members, not just take tasks working during the normal local time, 9 to 5 daytime. We work with the practices time zones. If it's 9 to 5 Eastern time, 9 to 5 PST, we work through their times, and they know people by name. Hey, this is my extended staff member. If they're working with John Doe, they work with John Doe. They're working with Jane Doe, they work with Jane Doe. So now, one more thing I wanted to touch here, thanks to AI, now with the pronunciations of different words, there are AI tools that we have already implemented in our company, which are referred to as the accent neutralization tool. So what happens? It works in real time. If somebody sets schedule, it will change it to schedule. So the other party, just like if you have a Samsung Galaxy 24 or 25, you can speak in English. The other party can, in live transcribe in Spanish. So we are taking the advantage of the latest AI technologies and making sure we're able to provide better services to our clients, of course, at a fraction of the cost. 70% is guaranteed savings. I spoke about this, down from $60,000. If you are spending 600,000 on 10 resources, think about it. You can go down to 200,000. That's a whopping $400,000 saving on just 10 people. But I'm not here to say to replace everyone, because people should not be replaced. They should be given a helping hand. That's why these are called sometimes assistants. People don't like that word, these days, but then they will come handy. They will go on autopilot, and they will take away your administrative tasks. So before we jump there, I had a question for you, Dr. Wade. As a physician, we're not ending the session yet. We still have time. I still have comments to handle. What's your advice to other doctors considering outsourcing, and how can that help reduce workload, improve their efficiency and patient care, and so on and so forth?
Sure. So I think, I had some of the same questions that most people have. And I feel like, trying something out is important because, somebody can tell you things. I'm a little skeptical when it comes to people saying, okay, we'll just try this out. So I would say, for our practice, I had a hard time, we do have staff in-house, but we did have a problem with retaining staff. Right. So it was like I would train somebody and then they would be there a couple months and then they would not come. And so I needed a little bit of reliability as well. So that's why I looked into, outsourcing a couple of things. And so I think for our practice, you always have to remember, though, if you are looking at this, you have to kind of know or kind of look at your practice and see where can somebody be helpful. So for us, for example, we already have a billing company that does verification. So that wasn't something that I needed. I needed somebody who's going to schedule, answer the phone, and kind of take messages as well, and then prior auths. We also do still have paper charts. So I am scanning, uploading scanned documents to our EMR. So our virtual person helps with that as well. So I think for physicians thinking about using outsourcing, it's important to also know that it's not just it's like an ongoing process. You do have to be involved in how you train a little bit because you're the one who knows how your office works, how the EMR works. So coming up with solutions to a problem, that's also very important because if you can do that, you can really target where this person can come in and help. So I think it's been helpful in the sense that I have somebody who shows up, most of the time, well, all of the time, because it's only been a couple of months since I've been trying this out. So I think, taking off those tasks that usually you're burdened with gives you more time to do other things. Like for me, the timing of finding out what medications are covered, somebody else could be doing that while I'm seeing the patient so that I can get back to them in a more timely manner and figure out whether we need to do a prior auth or we need to switch the medication. So that's been helpful as well. Obviously, it doesn't replace your internal staff, but I come up with things that my virtual person can help me with. So you really have to kind of understand where you need that help. So I would recommend for anybody that's considering it, it's always a good thing to try something out if you can and see how it works out for you. But just know that you are going to have to be involved in training the person and kind of like advising them on what things you need for your practice.
Okay, thanks a lot, Dr. Wade. That definitely I need to add one point here when you said, um, you know, the alternatives for medications or surgeries. Once again, for viewers, our staff members come with higher healthcare degrees like PharmDs, MBAs in healthcare, nurses. So they know what is generic, what is the brand, what is a surgery, they're medically proficient. They don't probably need training on, what is a drug. So that's something I wanted to add here. And before we get into taking a small break, I have one of my clients, our, oldest client here from a large long-term care pharmacy, Mr. Israel Buxbaum. Hello, Mr. Buxbaum. Hello from this tri-state area, current happy staffingly client. Thanks for that wonderful message on LinkedIn. I didn't expect that you would, join this and then, post this comment. Of course, you're definitely happy about he's one of the outsourcing directors at a large top long-term care pharmacy. Thank you, Mr. Buxbaum. So, Control, can we take a quick break for 2 minutes and we'll come right back? Have some water. We've been talking a lot. Let's take a break. And please stay tuned. Don't go anywhere. Please post your comments and we will take them as questions and answer any of your queries.
The phone rings and receptionist picks up. Hello, this is doctor's office. Please hold.
All of our representatives are currently busy. Please stay on the line, and your call will be answered by the next available representative. The estimated hold time is currently less than 96 minutes. You are currently caller number 32, waiting to speak with a representative. Thank you for your patience.
The patient waits and waits. Frustrated, they hang up and call back. Doctor's office, please hold. Again, sounds familiar? Hold on a minute, I'm checking, she replies, placing the call on hold. After a moment, she returns to wrap up the conversation before hanging up. A few minutes later, another call comes in. Another patient waiting for prior authorization. The nurse sighs and answers it. Hold on a minute, I'm checking, she says again, juggling endless tasks. She ends the call, only for the phone to ring again. Now a request for an appointment. She glances at the system, but the schedules are buried under layers of other work. Patient notes, paperwork, and insurance requests all vie for her attention. As another call comes in, she hesitates, then lets it ring. Another one follows. She sighs again, not picking up. Work keeps piling up. The healthcare provider is losing money, faster than they can count. Endless insurance calls, denied claims, pending authorizations. Every delay means lost revenue. Every mistake adds to the chaos. The staff scrambles, tossing out documents while keeping stacks piled high on their desks. They rush back and forth, trying to figure out what to do first. But the work keeps piling up. And so do the losses. Phones ringing non-stop. Patients waiting. Billing errors leading to rejected claims. Then the doctor walks in, frustrated. What the hell are you all doing? The staff looks up, exhausted. Doctor, we have so much work, we just can't keep up. Another claim denied, another hour wasted on hold. Another paycheck slipping away. The doctor sighs, shakes their head, and walks away. Just as frustrated, not knowing what to do next, he sits down at his desk, exhausted. He looks at the stack of papers and notes in front of him, unsure of what to do. Back at the desk, the nurse sits frozen for a moment. The calls are still coming. The paperwork hasn't moved. The system still displays an overwhelming number of pending tasks. How can I do all these things? Is there any solution for this? She thinks for herself while doing the heavy work.
All right, welcome back. That's a wonderful AI video presentation by our video team, AI team. We already have a lot of AI. This video is completely created using AI, and our prompt engineers, made sure this is what we wanted. So which depicts how we are effectively using AI, not just creating a video, but then in our practice, while working with our healthcare providers. Now, I still have a few comments to take over, but then I would like to quickly jump into who is Staffingly and why we are doing this and how we do this to save you 70% take off the administrative workload. So, Staffingly Inc., we've been in business for over 7 years now, and we support healthcare providers across the 50 states. We support hospitals, long-term care pharmacies. We just had a great comment from one of my large clients, MSOs, networks. We work with bunch of networks in the state of Florida. We work in California, hospital systems, and anything that you can think of, healthcare administrative tasks that can be outsourced, right from virtual medical assistants with a fallback of AI voices. If somebody's taking phone calls, what if the phone call is missed? This is not going to be something that we want to send to voicemail. No more voicemails. We take the calls. There's a voice receptionist, limited voice receptionist, which is not collecting any PHI data. It will talk to the patients, required schedule bookings. That's something we're trying to control a little bit now. Send a transcription of what the patient wants. And in the future, once, looking at how the FCC is going to come up with this, or the governmental regulations, health departments, then we can certainly implement, connecting with the EMR, downloading data, refills. There are a lot of companies who are claiming to do so. I'm still not sure, what would be the new regulations with PHI. Now, they can, our staff members can handle anything from just the phone calls, not just again answering service. They can work with your patients, they can update the charts, they can do e- efficient insurance verifications, they can collect copays, they can talk to them about cost sharing, and do a lot of things. And they are proficient in tons of EMRs, which I will cover a little bit later on. But then before I get into talking to our other guest and ask him about how this process is being done, I would like to quickly see what people are commenting. I do see one comment from, give me 1 second. I have a lot of them. Okay, Trisha Sen. How can medical practices measure the ROI of outsourcing, and what are the key metrics to track? Trisha, I can take that question. It's definitely an interesting question here. It's pretty simple. If you are, there are two types. One, maybe you are referring to AR calling. It's that is, collections is probably just based on, if they're collecting $1 million, there are companies who do a 3%, 4%, going up to 10%. So that could be measuring the return on investment. But then, what we do, we certainly provide a report on the number of tasks handled, time saved on a weekly basis. So that's how you can measure the ROI based on the reports after we start working with you. We can get into more details on this. This could be something more private, because I need to get some numbers from your practice. You can visit staffingly.com, or staffingly with an ly, staffingly.com/demo, or call us at 800-489-5877. And I promise to be on your demo, and we can talk about this. Mr. Wiki, we struggle with long patient hold times. Can a virtual assistant really help reduce call wait times and improve patient satisfaction? That's an interesting question, Mr. Wiki. This is all this is about. Imagine, if you ever walked into a five-star hotel, they answer calls in the second ring. But here, if they answer the phone call in the second or third ring, they're already on a call with a patient or an insurance company or the provider. Now they're putting them on hold, going to another call, pick up the call. We just played that video, and say, "Doctor's office, please hold." Now why that patient goes on hold. They're going back to the other whatever. Then the third phone rings. So this is what we are expecting to control. Not send patients to on hold, not send them to voicemail. I have logged into bunch of phone systems for our clients. One doctor, I have seen 500 voicemails in the last 6 months. No one ever returned those phone calls. And one doctor said, I don't even know. We missed the calls. We just ignored. So isn't this loss of revenue? Isn't this loss of, a patient is coming with a disease. Doctors are here to save lives, not just ignore their phone calls, right? So this is what we want to really cut down at a fraction of the cost. Yes, to answer that question straight, virtual medical assistant is required to assist, take all the calls as much as they can, and return every phone call if there's, one person can only do one thing. And our VMAs are trained not to just take the other call. They will politely tell the other person rather than saying, hey, please hold. They would probably say, I'm on another call. I'll call you back in a minute. I'll call you back in 2 minutes. I'll call you back in 3 minutes. And they don't spend 15, 20, 30 minutes with discussing with patients personal stuff. They're strictly professional. They will ensure they talk to the point and not give them any medical advice, only provide them information what is authorized by the doctor or the healthcare provider under their guidance. Once again, thanks, Mr. Wiki. That was a good question from YouTube. I still have more questions coming in, but I would like to continue with our conversation. So we have 300 plus agents right now, all HIPAA certified. They all have healthcare backgrounds. 90% of our staff members come with a doctorates in pharmacy. And by the way, we also have US licensed pharmacists, active license holders in the US that are working from India, assisting our team members. They know the intricacies. They work with large pharmacies like Walgreens, CVS, and they know how the prior authorization process works. They know about insurance eligibility verifications. They pretty much know the process and to the extent. Now I'll quickly jump into Dr. Nawaz to continue our conversation. Uh, so, Dr. Nawaz, can you explain how Staffing League can help the healthcare providers with your team members? You are also a part of large team member. You're a team leader. You're a manager. So, how do you think try to we are running out of time. Dr. Vaid has been very patient, and she has a lot of patience with her patients as well. But then can you before we wrap this up, can you quickly cover this, please?
Sure. So staffing leads, virtual medical assistants, we all take up critical administrative tasks like, let's say, starting from scheduling and patient coordination. Let's say if it is a chemotherapy session or a prenatal visit, uh, it could be anything. We manage appointments seamlessly and scheduling very well. And next comes up insurance verification and prior authorization. You don't have to be on hold with insurance companies for 1 or 2 hours on a phone call. Our staff can do that for you, and our AI can do that for you as well. So, and talking about prior authorizations, let's say if it is a radiology scan, pain management injection, or any specialty drug, we ensure faster approvals by, as we already spoke about it, we have the clinical criteria. So we follow that. We make sure we're submitting all necessary documentation. And the most important part, we follow up with insurance uh, to make sure it gets approved. And if required, we also get in touch with insurance, the nurses or the clinical reviewers over there, so that we're giving the most of the data which is required for the approval, and we make sure that gets approved and paid. That's about insurance verification and prior authorization. And talking about medical scribing, most of the times it's the emergency physicians, neurologists, and endocrinologists we have. They get benefit from real-time documentation support. Uh, Revenue cycle management. Our billing specialists, we have a wonderful team of billing specialists, and they handle billing, coding, payment follow-ups, AR denials, everything seamlessly. So, this way, we reduce delays, we minimize denials, and we help providers gain maximum revenue and at the same time cut down costs by 70% and while enhancing the patient care.
Okay. Thank you, Dr. Amir. I just want to quickly, Amir, can you also talk about, what specialties do we work with? I see a lot of, dental offices. I see, from people who have clicked attend on LinkedIn, practice, hello, yeah, once again, hello, everyone, all the practice administrators who have the, I think, dental practices also have a lot of issues, and they wanted to, join this webinar to see, how we can help. We do work with, several specialties. The only thing, this will take on forever, if we have to talk about each and every specialty. But then in general, like Dr. Amer Nawaz was explaining, we work with dental offices, cardiologists, we work with endocrinologists, internal medicine, family medicine, pediatricians, dermatologists, psychiatrists, TMS, hospitals. So the list goes so on and so forth. But then on and on. But then definitely, if you schedule the demo, it's worth it. 15 to 20 minutes. It's not going to be for an hour. Unless you have questions. But take advantage. Without an obligation, there's a 2 week free trial. So no questions asked, risk free. Even during the 2 week free trial, most companies don't do that. We will still execute that business associate agreement to make sure you are covered under the PHI and you are the covered entity. And we will still give you a certificate of insurance. The 2 weeks, after the 2 weeks, you don't like our service, we say a sweet goodbye. And by the way, we don't have any setup costs. You're not paying nothing for setting up. You're not buying us any equipment. We are not the typical employer on record or agent on record service. We are the direct employer. So we employ our own people. We give them the top benefits. And if you can check our Google reviews, 90% of reviews are coming from our employees. Obviously, they're happy. We try to keep every employee happy because we're all, end of the day, we have to work with the with humans. Now, there's a two week free trial. Take advantage of the free trial. It's absolutely risk free. And many clients have asked me, is there a long term contract? There is no long term contract. It's a month to month scale. Anytime you don't like it, we expect that you give us a 15-day courtesy notice, and just for us to relocate the staff members to other projects. That's all we ask for. There are no long term contracts. There is no mess. It's worry free. No investment upfront. No 3 months. You pay me to $15,000. So I get started, and then I don't even begin the work for 15 days. Because I've tried to hire a lot of people myself, a lot of subscription based platforms, especially after the evolution of AI. 15, 20 days they take it to set it up, so they eat up $2 or $3,000. We're not going to do that. This is in black and white, clearly depicted in our standard services agreement, followed by a business associate agreement, which is signed by a local company in the US. It's not a company that you're sending money overseas. You are paying a New Jersey based local company with good standing with the state of New Jersey. So before we wrap this up, I think we pretty much covered everything. If you want to talk to us, I will be supported by a specialist, one of our advisors. She's a licensed pharmacist. Each demo, we sit down together. We try to help people. Even if you don't want to, right after this session, I'm talking to a customer. That's something I'm not going to be able to help them, but I will be spending the 30 minutes. They have some questions on, they're actually hiring another company for something similar, not completely directly what we do, but she wanted my help in how we can how they can hire them to for compliance. I said, you should be talking to an attorney, but then she said, based on our experience, how we've been working with other clients, she wants some pointers. So take advantage of the 2 week free trial, and we can go on a demo. It's worth it, 15 20 minutes. And then we can quickly get you up and running in about 2 or 3 weeks, get your staff members ready. And after 2 weeks, you like it, we continue, or we say a sweet goodbye. So Dr. Vaid, what are the final thoughts before we wrap up this session?
Sure. So I was going to say anyone can reach out to me on LinkedIn if they have any questions as well. So my passion is to make sure that doctors are able to take care of their patients and be more efficient and also have like a good work-life balance. So in terms of how technology is kind of helping us doctors to take care of patients through AI, through virtual assistants. I think all of them can be very, very helpful. Just examining where your deficits are. For us, I think answering the phones was a big deal because I joined my dad in practice, so I'm building up my patient panel as well. So there's more patients that are calling in. So we were missing those calls because I didn't have staff. So those patients that were calling to ask questions or schedule appointments, we were missing those. And so I think with the virtual help, we are actually capturing those. So I'd be more than happy to talk to anybody if they had any questions about also increasing revenue and efficiency in their practice. I think this topic, this webinar has been great because Dan touched on a lot of points, and so. But I think it's worth trying it just to kind of see if this is a good fit for your practice. It's not a perfect, but nothing ever is. You have to work towards it, and also understand that person is not in your office. So you have to kind of walk them through a lot of different things at the beginning. Like anything else, there is a startup investment in time, and you will see the results, if you work hard to kind of integrate that person into your practice.
Thank you, Dr. Wade. I have a comment here,
Sure.
which I would like to take myself. I've seen many doctors, a LinkedIn user, struggling with insurance verification EMR and trying to manage their time, and it's hectic. Really hope someday you expand to UAE. Send me a message on LinkedIn. I would love to expand into, with other businesses. We have our footprint in Mexico, Canada, India, Sri Lanka, Bangladesh, and United Kingdom as well. And I would love to. I've been exploring setting up a company in Dubai in the free trade zone. So, send me a message. My LinkedIn handle is Dan DANNANDAN Dan Nandan. You could just search on LinkedIn. You can find me or go to Staffingly, or just send me an email. I would love to have a conversation with you. I will take the next comment before I jump into Dr. Nawaz. Sirisha, does outsourcing make sense for small practices? Yes, outsourcing makes sense for any type of practice, small, medium, large, extra large. It doesn't really make a difference. Everybody needs small practices, maybe need one person who can handle all these tasks. That's a good question, actually. All the tasks from doing the schedules, taking the phone calls, inbound, outbound, insurance verification, updating the EMR. We have a lot of solo practices where we have our virtual medical assistants do the 360 degrees of the administrative work. So it does make sense, and it makes big sense for larger hospitals or MSOs. So before we wrap this up, I have one last question to final thoughts from Dr. Amer Nawaz. Nawaz, what do you think, based on your experience, how outsourcing and your staff members, our staff members, are they efficient enough to reduce costs and the burden on the providers and enhance the patient care? And what do you think? What is your final golden word to wrap this up?
Sure. So AI and outsourcing are game changers in healthcare. That's one thing which I'd like to tell. And talking about efficiency, our trained specialists and AI together, we speed up the process, which reduces the wait times for critical treatments. Talking about costs, reducing costs, a full-time billing specialist might cost them 60 to 70K dollars a year, but if they outsource and then a highly trained outsourced a specialist here would cost a fraction of that. And talking about enhancing patient care, less administrative burden or lesser admin time. It means more focus on patient outcomes. Uh, let's say whatever the specialty might be. And my advice would be, start small, outsource your prior authorization, scribing, billing, other stuff. You know, your goal isn't just to, cost savings. It's not just that. Your goal is to reduce the burnout. Your goal is to improve efficiency. The goal is to ensure patients receive the care they need without delays. You went to medical school not just to fight with insurances, you went to medical school to treat patients, right?
Okay, thank you, Dr. Nawaz. And before I wrap this up, I forgot to touch one topic here. If you plan to use our services, one thing is, our team members are very proficient using EMRs. I didn't touch this. Anything starting from Practice Fusion, eClinical Works, Athena, Advanced MD, Epic, you name them, and Cover My Meds, Ability, Clara, doxy.me, the list goes on. And if we don't have knowledge, we'll quickly try to use the latest AI tools to learn them pretty quick. So having said that, if you are, and if you're a healthcare provider, uh, and you plan to use our services, you went to medical school to save lives, right? So not to get buried in the administrative task. And if you're ready and if you'd like to test us out, I'm the business owner. Once again, I'm not a sales guy who will get you into a contract and then disappear. It always happens. I know that. I'm still trying to, oh, this is not, they don't even answer phone calls. And the salespeople is done now. Call my tech support or call my operational support. That ain't going to happen. We will be with you during the process. And during the process, after the process, I just had one doctor who came back, it didn't work for him, he tried for 3 months, and then he had an issue with the front office staff, the way um, you know his business model. But after a couple of months, he came back. He wanted to do another project with me. So he said, it's because we're always in touch, and we make sure how do we handle with 300 agents, so many clients, we manage our time. Me and my partner, we manage our time. We make sure we are looking through the emails. And of course, I use lot of AI tools. I do a lot of automation. I get messages on my cell phone, summary of what's important, that I should handle, what is spam, what is newsletter. So I do all these automations myself. I have a lot of workflow set up with using the latest AI tools. And we definitely ensure our tasks are properly, if there's a complaint, there's a challenge, there's an issue. And one of the doctors said, "Hey Dan, why did you answer my call at 11:30 in the night?" I said, "I'm a business owner just like you." So please try us out. Once again, it's staffingly.com, STFFING, staffing with an L as in Larry, Y as in yellow, staffingly.com/demo. And our phone number is 800-489-5877. And once again, thank you, Dr. Vaid. Thank you, Dr. Amer Nawaz. And thanks everyone on LinkedIn and YouTube for your exceptional. I didn't expect to have so many people watching this today. We were thinking maybe this is our first webinar, and we will come back every Wednesday with a topic. This is something we wanted to have an overview of how the outsourcing works, how outsourcing to India works, and what is the how you can take care of those staff shortages and not paying any more unemployment insurance. You're not paying benefits, you're not paying nothing. So check us out, staffingly.com. Signing off, this is Dan Nandan, CEO, Staffingly Inc. And thanks everyone. Have a wonderful rest of the day and enjoy your weekend.